Hello, hi, thank you for joining me. This is Dr. Erica, Onegbola pharmacist, pharmd for close to 10 years. Thank you for joining me on this particular video. I'm going to talk about distribution of medication, or the branch of pharmacokinetics that deals with how much the medication expands throughout the body. So once absorption occurs through the stomach lining, through the intestine lining, the medication now begins to either bind to tissue or bind to plasma protein, or it acts freely throughout the body as free particles, and they go to the action of site where it needs to work to eliminate the disease, or to eliminate the allergen, depending on what the situation or disease state is indicated for the particular drug. So again, once absorption happens, the medication experience distribution. Okay, and distribution depends upon what? The plasma. The plasma protein, as well as the tissues of the organ systems. Different organ systems actually have an affinity for the drug, so the drug may be bound, and then the drug may sit there for a while, and then it disassociates slowly and becomes free again. Now, medications, particles that are normally free, they don't tend to bind to protein or have affinity for proteins and tissues. They circulate through the body freely, and that is called free distribution. That's the part of the medication that determines a drug's distribution. Okay, so the distribution rate again is going to be that portion of the free drug that circulates again freely, and that helps scientists to determine the half-life of the medication. That means how much of the medication is circulating and how much is going to be eliminated. Half-life also refers to the half time at which half of the medication is gone throughout the body, and how much, or the other half, that is eliminated. So half-life determines, again, the time required to eliminate half of the medication from the body. And that's a term that is mainly used for medical students and pharmacy students. Okay, so again, distribution, after absorption occurs, distribution happens because the medication again begins to expand throughout the body. A large distribution means that the medication is more free than bound. A small distribution throughout the body, or small concentration floating around the body, means that the proteins are mainly bound to tissues, to fats, to muscles, to organ systems, to plasma proteins in the bloodstream. And so the concentration of free drug particles is smaller than the concentration of plasma proteins that are bound. And so that's a small distribution. Okay, so thank you for joining me. That's all that I have for distribution on this particular video. Please like, share, and subscribe. Thank you for joining me. I'm Dr. Erica.